In this video, we'll be going over how to treat high blood sugars. So first of all, what exactly is a high blood sugar? How high is high? So anything significantly above your target ranges, if you are usually within those ranges, would be considered high. So for example, if your target is to be under 180 2 hours after you eat and you check and it's 250, that's significantly higher. And especially if you're usually under that 180 mark, that's significantly higher than what you usually are. And it's higher than your target ranges. So that would be a high. Or if you're not usually within your target ranges, anything significantly higher than your usual readings would count as a high. Usually over about 200, we would consider this to be a high that you should take action on and lower. However, if you have higher blood sugar readings than that on the regular right now, you may need to be looking at more of a long-term plan versus these immediate steps to take. But let's go ahead and go over what to do when you do have a high blood sugar reading. Just one last note, it is normal for your blood sugar meter, your glucometer, to have a little bit of range and variation in the readings. It's not 100% precise. It's very accurate, meaning it gets close to the right number every single time, but it's not precise, which means it doesn't get the exact number. There can be a little variation there. So if you're normally at 180 and one time you check and it's 190, that could even just be a variation in your meter. That's not something I would worry about. But if you're getting more than 10 or 15 points away from your usual, that's when we would start to think like, oh, this is high. Or if you're having symptoms, if you feel like you're high, and we will be going over on the next slide. So the first step is if you feel like you might have a high blood sugar, go ahead and check it so you know exactly what number you are dealing with. And some indicators you may have if you have high blood sugar would be increased thirst and dry mouth, needing to urinate more frequently, feeling tired and fatigued, having some blurry vision, or just otherwise feeling off. Different people do tend to have some different symptoms. So if you feel off or you just happen to catch that you have a high blood sugar, when you check your blood sugar, if you do have medication for this situation, go ahead and take that medication as prescribed. So the first thing is to check your blood sugar, and if it's high, take meds as prescribed. The next step is to check for ketones. Now, ketones can occur when either your body is not processing carbs properly or you are not eating enough carbs and your body starts breaking down fat for energy. So when we have a high blood sugar, that's a really good clue that our body is not processing carbs properly and we might have ketones. So when ketones build up, ketones are acidic and they can make your body become too acidic, which can lead to DKA or diabetic ketoacidosis. This is the number one reason I used to see people with diabetes in the hospital is because they came in with DKA. So we always want to check for ketones when you are running high. So if you're over about 240, go ahead and check for ketones. If they are present, call your provider or even get emergency care. And do not exercise. It is not safe to exercise when ketones are present. Now, not every doctor prescribes ketone strips, and you have a few options in that case. You can ask your doctor to prescribe them for you. You can buy them yourself. Or you could even just assume that you might have ketones if you're over about 240. Or you can also, if you're over 240 but you don't have like any symptoms, you feel fine, you probably don't have ketones, but we don't know for sure unless you actually check with a ketone strip. So there's a few different options there for if you don't have a strip. Step number 3 is to drink at least 2 cups of water and continue drinking at least 1 cup of water every 30 to 60 minutes. This will help dilute the sugar in your blood and help start flushing it out of your body. One note here is that if you are on any fluid restrictions, like if you have kidney disease and you have a fluid limit, make sure you're still staying within that fluid limit. But that won't apply to the majority of people. If that doesn't apply to you, go ahead and follow these guidelines. Step number 4 is exercise. So if your sugars are under 240 or your sugars are over 240 but ketones are not present, try some light physical activity like walking. Physical activity and exercise is super powerful for lowering your blood sugars, both in the short term if you're having a high blood sugar and in the long term. They actually, when you exercise, it actually decreases your sugar on average for the whole next 24 hours. It's good for a whole day. And as you exercise more and more, that helps with your overall insulin sensitivity too. So it's great for your long-term diabetes care, but it's just also super powerful for in the short term. On average, walking 1 minute lowers your blood sugar by about 1 point. You might vary from that, but so on average, if your blood sugar is 10 points over where you want it and you walk for 10 minutes, you can get that back down into range just with that. So it is definitely a powerful option. So when your blood sugar is elevated, after you go through these steps, you want to go ahead and recheck your blood sugar in 30 to 60 minutes to make sure it has come down. If not, just go ahead and continue these steps until it does come down. A little note here, even if your blood sugar is still elevated, make sure you don't miss your regular meals and snacks. If you go too long without eating, your liver might think, oh, hey, I got to make sure you don't have a low blood sugar. I'm going to produce some extra sugar, because when you have diabetes, the signaling doesn't quite happen right with your liver. So you want to make sure you don't go too long between your meals and snacks if you're having this out of range reading. Just don't skip your normal meal and snack time, whatever that looks like for you, if you have a high blood sugar.